Good morning, everyone. Welcome back to my YouTube video channel. I just want to show you how Matic 500 can do a lot of things for you. This is the case where we did the crown prep on number 4. You can see that you can evaluate the space between the teeth, especially those cases where there's not a lot of teeth. It's hard to take a good impression, and when the lab pour the model, usually they tend to break a couple of teeth. Very hard to make a nice accurate space between the bite restoration between the two teeth, so they can give you a right price. The right crown for you. So with the digital imaging, it allows you to move the art around and evaluate the space. So that's one case. I'm going to continue to show you more here. Just a second. So this is number 6, another case. You can see that you can evaluate and see how much room you have for the crown in case when the crown coming back before you deliver, you know which spot that consider potential high spot, because depend on how much prep that you prep. So this is number 6. I think I have enough space there. So you see, with the Matic 500 machine, you can capture image without totally taking a total impression. Good morning. This is number 12, another case. On the left side, you can see sometimes you don't have to take this many, you don't have to scan that many teeth. I just want to keep the records, especially those patients that have first time crown in this office. We want to keep the records so we have some idea how the teeth look like. It's a part of the record that it can help you to identify the patient in case you lost the chart, couldn't find the chart. You can see the case inside and you remember the patient by looking at the model. Good morning. Here's another case. Patient came, lost the implant crown, so we scanned this and then we adjusted the margin of the crown, took another impression. We don't have to scan that many teeth, but I just want to do it just to keep the record for the patient, especially patient first time seeing me. It's a case that's interesting because we have a scenario where patient wear the upper partial denture, so I used to have to prep the abutment for a crown. So this was tube number 4 here. So we scan her prep, and also I put the denture on, so that way the lab can know where is how much room the lab have for the crown. So this is another tube on same patient, tube number 20, right there. I'm going to show you the upper arch just to have an idea what I'm talking about. The upper arch, I prep the tooth, put the denture back so the lab can figure out how much room the lab have for the meso part, because we have a class on the buccal here. We don't want the lab to make it too loose or too tight. That's the upper, and this is the lower now. Here we go, the lower. That's the prep of the lower. Number 20. Anyway, we done so many cases this is number 12 and 13 and 14. As you can see, 2 crown at the same time. Now look at the bite. This bite doesn't seem to be accurate. We might have to do some adjustment when you evaluate this bite here. So that's how you look. You know, you look at the K and you evaluate the potential problem, whether you have later on when you have the crown on hands and deliver, and you look at the model, you can figure out whether the bite was
Sí se puede.
taken properly. Thank you guys. Have a great day. Bye bye.